Imagine this. You're just going about your day, everything's normal, and then bam, out of nowhere, this sharp, intense pain hits you. It's that kind of frightening moment where you just think, what is going on inside my body? Well, together we're going to dive into one of the most common reasons for that exact feeling.
So, you feel that sharp ache right in your back, just below your ribs. What could that possibly be? Well, for millions of people, that is the very first, very clear sign that they might be dealing with kidney stones.
And that's really the scariest part, isn't it? One minute you're totally fine, and the next you just can't get comfortable. So, let's pull back the curtain on this mysterious pain, because, understanding what's actually causing it is the first real step toward getting some relief. Now, if you've ever felt this, you are definitely not alone. This is an incredibly common thing to go through. But here's the key. The real power comes from knowing what to look for before that pain gets out of control. Seriously, catching those early signs can be the difference between a manageable problem and a trip to the emergency room. Okay, so what is this thing? What is this culprit behind all the pain? Let's get a really clear idea of what we're actually up against here. Honestly, the easiest way to picture a kidney stone is to think of a tiny, hard pebble, or maybe even a sharp little crystal. They basically form inside your kidneys when there's too much stuff like calcium or other salts in your urine and not enough water to dissolve it all. So why do these little pebbles even form? Well, it usually boils down to a few key things. The number one cause? Not drinking enough water. Simple dehydration. But what you eat matters a lot too. Things like too much salt or animal protein can contribute, and sometimes it just runs in the family. But here's the thing. A stone just hanging out in your kidney, that might not cause any pain at all. The real problem, that intense, awful pain, starts when that little stone decides to go on a trip. And that's what we're talking about here, the stone's painful journey. And this might surprise you. You can have a kidney stone and have no idea. The symptoms don't usually start with a huge bang. Nope, they start with a whisper, so quiet and subtle that it's actually really easy to brush them off as something else. So what are these whispers? What should you be looking out for? Well, it could start as just a dull ache in your back, or you might notice your urine looks kind of cloudy or has a weird smell. Maybe you see a pink or brownish color that's a little bit of blood. And another big one is feeling like you have to pee all the time. These are the little clues before the real storm hits. Okay, this right here is the turning point. As long as that stone is chilling in the kidney, it can be pretty quiet. But the second it starts to travel and gets into the ureter, that's the super narrow tube that connects your kidney to your bladder, that's when the pain just skyrockets. And the pain itself kind of tells the story of where the stone is. It's not a pain that just stays in one spot. It usually starts up high in your back or your side, but then as the stone moves down, the pain moves with it. It'll radiate down towards your lower stomach and eventually into your groin. This traveling pain is such a classic sign. And as that pain is moving, other major league symptoms usually show up to the party. You might see very obvious blood in your urine or feel a really sharp, burning feeling when you try to pee. And the pain can get so bad that it actually triggers waves of nausea or even vomiting. Your whole body is just reacting to the intensity. Now, I need you to listen very carefully to this next part. This is probably the most important warning sign we'll talk about. If you have that awful pain and you also have a fever and chills, that is a major red flag. It can mean you have a serious infection and you need to get medical help right away. Don't wait. Okay, so recognizing the signs is step one. But what happens after that? Let's switch gears and talk about the solutions. Because even though the pain is terrible, the good news is that there are some really effective ways to get relief. The treatment really all depends on how big the stone is. If it's a small one, the game plan is usually just to help you pass it on your own. That means drinking a ton of water, taking pain meds, and sometimes a doctor will give you medicine to help relax the ureter to make it easier. But for bigger stones that are stuck, you need a medical procedure. That could be something like lithotripsy, where they use sound waves to break the stone into tiny pieces, or ureteroscopy, where a doctor uses a tiny camera to go in and either zap the stone with a laser or pull it out. Look, once you've gone through a kidney stone, the absolute last thing you want is a sequel. So let's get to the most empowering part of all this: how to prevent it from ever happening again. And here is your game plan. It's actually pretty simple, but it works. Number one, above all else, stay hydrated. Drink lots of water. Your goal is to have your urine be a pale yellow color. Number two, take a look at your diet. Cutting back on salt is a big one, and so is reducing how much animal protein you eat. And finally, number three, managing your weight can make a real difference in lowering your overall risk. So, what's the big takeaway from all of this? It's that your body is constantly talking to you. From a little ache in your back to the color of your urine, it's sending signals. The trick is just learning how to listen. Recognizing these signs isn't just about dealing with pain, it's about taking control of your health. So I guess the final question is, are you listening?